Good afternoon. My name is Colleen Danny Luck, RN, and today we will be reviewing how to do a physical head-to-toe assessment. Here's my patient, Miss DH, and what we'll do is I've already identified my patient. I will explain to her the physical assessment process, and then I will make sure we have privacy. I will make sure I gather all my equipment. If I have not done so already, I will also make sure that she's comfortable, she is safe, all the things that need to be in place before we actually start the process of physical assessment. So we just make sure all of our equipment's clean as well. Good morning, Miss DH. How are you today?
Fine, thank you.
Good. Now, my question is we're going to assess your level of consciousness, all right? What, can you just give me your initials first, ma'am?
DH.
Okay. Do you know what year it is?
2015.
And do you know where you are?
Yes, I'm in the doctor's office getting a physical.
That's how you assess level of consciousness. Person, place, and time. While you're doing this, you can also assess her general appearance. As you can see, her whole body, she looks nice, clean, neat. Hair, is clean, nice, pulled back a little bit behind her ears. All of this says that she has good mental health status as of right now. If she were dirty or she had her clothes were rumpled or anything like that, that would indicate some mental health issues. Now what we're going to do is we're going to make sure that we do her vital signs. So we would her temperature, her blood pressure with the blood pressure cuff, heart rate, respiratory rate, and her O2 sat. So we've already assessed her LOC, we've already assessed her vital signs. We would also assess her body weight, her BMI. We would do that through mid-arm ratio, height and weight. All those are in conjunction with each other. So we would just basically do a real body measurement. Then we would also assess vision. So for the neuro assessment, we've already, of course, assessed the LOC. Now we're going to assess her symmetry of her face. As you can see, everything is midline, okay? There's no unevenness in her body like this or this. Everything looks to be like she's in midline, her upper extremities, her lower extremities, and her face. She also opens her eyes spontaneously as well. And just in general, she has great hygiene. Now, as we move in from the neuro assessment, we're also going to assess her head, ears, nose, and throat. In order to do this, we can also assess her cranial nerve. Cranial 1 nerve is assessed by her smelling an object. So I'm going to have her occlude one nostril. So if you can do that, close your eyes and tell me what you smell.
Irish Spring soup.
Okay. Can you go ahead and occlude the other nostril? What do you smell?
Same thing.
Okay. Good. Good. So we've assessed her cranial 1. Now we're going to assess her cranial 2 and 3, and we can do that with Perla, which is what we're going to do is we're going to shine a light in her eye, in each eye, and we're going to see if they're going to constrict. So, okay. And I'm sorry, that's a bright light. So for this, her left eye will not constrict because of the left eye trauma. Her right does constrict. So that's cranial nerves 2 and 3. Cranial nerve 5 is sensation. So what I'm going to do is I'm going to ask her to close her eyes and just touch her forehead, touch her cheeks, touch her chin, just in various spots, and see if she can tell me if it's left, right, or midline. Okay? Here we go. All right.
Left. Right. Right. Left. Chin. So midline.
So as you can see, she's able to have sensation in all of her face, so that's indicative of a normal cranial nerve 5 assessment. Cranial nerve 7 can be assessed by using a couple of different techniques. The first technique, I can have her smile. Very good. I can have her blow out her cheeks. There we go. I can have her frown.
That's hard to do.
I know. Go ahead. Do the best you... Do the best. There you go. So she can frown, smile, blow out her cheeks, and tightly close her eyes for me. Can you tightly close your eyes? Good. Good job. So that's assessment 7 for the cranial nerve. Cranial nerve 3 can be best assessed by giving her a word, whispering it to her in each ear, and have her tell the word that I'm using, and she can tell me what side she's hearing it from. So again, I'm going to have her close her eyes. Cat.
Cat, left side.
Cat.
Cat, right side.
Okay, good. So we know that her cranial 3 nerve is intact as well. For cranial nerve 9, we're going to assess her tongue strength and her taste sensation. Now, in order to assess her tongue strength, what we would do is have her open her mouth, and unfortunately I don't have a tongue blade today. We would have her stick her tongue out for us, so if you want to go ahead and do that, stick it all the way out for me. And we would push down on the tongue blade. And she would create some resistance by trying to push her tongue back up. Now we could also assess her gag reflex. That is cranial nerve 10. So what we could do is just kind of, again, push down on that tongue blade till she kind of starts to heave a little bit, and that will show us that she has a positive gag reflex, which is a normal finding for cranial nerve 10 assessment. Cranial nerve 11 assessment is also known as the spinal reflex. What we will have her do is we'll have her shrug her shoulders, just like this, and then what we'll do is we'll also have her push against my hand, push her head against my hand, so push, to show that the cranial 11 nerve is intact. Again, we'll push to the other side, and that'll show that the cranial nerve 11 is intact. At this point, we would also assess her oral cavity for any difficulty swallowing, her mucous membranes, make sure they're nice and pink and moist, no lesions are noted, no redness is noted. She has her teeth intact, so she doesn't have dentures, and we're going to go ahead and have her swallow for us. Okay, as you can see, she swallowed. We could also give her a little bit of water to drink, if appropriate, so we could see her actually swallow. The next thing we would assess is to make sure her trachea is midline. In this case, I would come around just like this, and I would come from behind and just make sure, kind of push just gently to the left, gently to the right, and make sure that her trachea is in fact midline with her body. Now we'll start the respiratory assessment. The respiratory assessment first starts with just assessing her breathing in general, noting the rhythm, which as you can see, it's about 10-12, which is normal. We could also assess just the way her general breathing, ease of breathing. As you can see, it's very calm, very even. It shows no sign of distress. The next thing we would assess would be to see if she's breathing with her accessory muscles. As you can see, she's not. And in this case, then we would go ahead and start to listen to her lungs. We would listen to her anterior and posterior lung fields. We would listen to her adventitious sounds, her bronchial sounds, her bronchiovesical sounds, vascular sounds, and her vascular sounds. So we will start right up above here. If you can go ahead and take a deep breath. Good, and out, in, out, in, out. Good. For her anterior, she is clear throughout all her lung fields. Now we're going to go ahead and do the posterior. All right, this is where it's, yeah, perfect. We're going to have her turn just a little bit more towards the camera. Go ahead, let's go ahead and have her breathe. Good. Nice deep breath in and out. Nice deep breath in. Very good. One more time. All right, very good. Her posterior lung fields are all clear. So now we move on to the cardio-peripheral vascular assessment. The first thing we will do is we'll go ahead and we will assess her valve area as well as the herb point by auscultation. In this case, you would have the patient just breathe normal for you as you go ahead and you assess the aortic, pulmonic. Those would both be at the second intercostal space, right close to the sternum. The third intercostal space is where you find the herb's point. The fifth, you would find the tricuspid and mitral, which is actually midline to the clavicle. Aortic sounds good. Pulmonic sounds good. Herb's point, tricuspid, and mitral valve. All you can hear a very nice, crisp S1 and S2, otherwise known as the lub-dub. Now we'll go ahead and we will palpate the different pulse sites of the body. So here you would check for the carotid. Nice strong pulse. And if you were to check the other side, you would also find a nice strong pulse, as well as equal. We're now assessing the radial, the ulnar, which actually would be assessed more so like this for most people, if you can just relax. Okay, that is nice, equal, and strong. You would assess that side, looking to make sure they're equal and strong. From there, you would assess the femoral artery, making sure that both sides are equal and strong, and we'll kind of skip that. But anyway, it would be in between, it would be in the inguinal space area where you would feel that pulse, and you just kind of reach down there and go ahead and just put your forefingers down there and feel for that pulse. You would do for each side. Now, what I'm going to do is assess her popliteal pulse. It might be easier. This can be a hard pulse to assess. From what I can tell, both are strong and equal. Now you would assess the post-tibial pulse, just like this. Okay, I can feel that one. And we'll go ahead and remove this shoe really quick. Instead, I'm just going to go ahead and assess both. And we'll assess the posterior tibial, nice and equal, and the dorsalis pedis, beautiful, nice and equal. From then on, we could also assess her upper and lower extremities for any edema and for capillary refill, as well as skin temperature. For capillary refill, you're going to squeeze, gently just squeeze the nail bed of one of her fingers, and you will count the seconds that it takes for the pink color of her nail beds to come back. As you can see, her capillary refill is about 2 seconds. That's within normal limits. You would also assess it on the other side. 2 seconds again. You would assess her feet. 1, 2, again 2 seconds. And 2 seconds. And you could also assess for edema by just ever so gently pressing into the skin to see if there's any what we call pitting. Pitting can be graded by +1, 2, 3, and 4. Okay. For your gastrointestinal assessment, we will now turn to the patient and we'll ask her a few questions. Can you go ahead and tell us how you tolerate your meals other than the GERD we have already discussed?
They're fine other than if I eat something spicy or that I'm not supposed to eat.
Okay. And when was your last bowel movement?
Today.
Okay. And the consistency and the color?
Brown and normal, not too hard or not soft or mushy.
Okay, very good. From here on, we would have the patient lie down, which we're not actually going to try and do for this assessment. So first thing we will do is assess the bowel sounds after we check for the symmetry, the contour, and the skin color and integrity of the abdomen area. Now we'll go ahead and assess bowel sounds first. Now it is important to assess bowel sounds before you percuss and superficial and deep palpation of the abdomen area. So what you would do is you would listen first. You listen in the 4 quadrants, the right upper, the left upper, the lower left, and the right lower quadrant. You would also assess midline. On top of that, at this point, you would also listen to vascular sounds, particularly the aorta, to make sure there's no aneurysm or other anomaly. From there on, you would go ahead and you would assess the abdomen area by percussing in various spots just to attempt to see if there's any changes in mass. You would also do some superficial palpation and some deep palpation. And now you would assess for your genitourinary assessment. So I would ask her history. What's your urine color like normally?
Clear, pale yellow.
Okay. And clarity, is it clear?
Yes.
Good. That's indicative of a normal assessment for the genitourinary assessment. And we would also palpate the bladder to check if there's any distension. And if she had a Foley, we would also check the Foley, make sure that that is in place correctly and that there's no bleeding, there's no lesions, and that it's flowing correctly. Now for the musculoskeletal assessment, first thing we will do is assess her active and passive range of motion. So what I'm going to have her do is just basically from head to toe, I'm going to have her bend her head down, bring it back to a baseline, have her tilt it back, good, bring it back, tilt to the side, tilt to the other side, and just make sure she can gently roll it around both ways. Good. Next, I would go ahead and have her assess her upper extremity, so I could have her bring her arms up, bring them out for me, bring them back, have her go around in a circle both ways, and go ahead and assist her with the elbows. Now you can do these helping the patient, such as passive range of motion. So in other words, I would help her by bringing them up, so that way I could assess her range of motion from her shoulder down. I could also help her bring it up just like before, out to the side, remembering to cradle that joint and make sure that it's protected in cases where there might be some issue with range of motion. Remember to never push a patient's extremity past the point that they can tolerate it, as you can hurt them and cause them pain. So then we'd go ahead and bring her elbow up. In this case, active. She would bring it up herself. Can you do that with the other side, please? Very good. Then we would go ahead with the wrist, have her bring it up, bring it down, to the side, to the other side, and we would do that again with the same. Good. Then we'd have her stand up. We can also have her do the ROM test at this time, where she puts her feet together. She's going to open her eyes, keep her eyes open, and then she's going to close her eyes while we assess for any swaying. This assesses for equilibrium. Okay, you can go ahead and sit back on there. And that's another way of assessing the hip joint to make sure she's got good range of motion there. You can see she can sit down on the table and sit up on the table. We can also assess her knee range of motion by having her lift it and put it down, lift and put it down. And for active, again, you would have the patient lift it herself, bring it down, up, down. Ankles, we could have her bring her feet back, let her feet just relax, and then keep doing, and just have her do that a couple of times. Just make sure she can kind of bring her ankles around and the other way. And now we would assess for muscle strength. A good way to assess muscle strength is you can have her go ahead and hold her arms up like this. You can have her grab your hands and have her pull towards her. So go ahead and try and pull them towards you. Very good. Then you go ahead and have her push away from you. So it's almost like playing patty cake, where you go ahead, push. Good. Have her squeeze both of your fingers and squeeze as hard as you can. You're looking to make sure all of the muscle strengths are equal and strong. Next, what we'd have her do is have her try and push me away. Go ahead, try and push me away. Very good. And try and pull me close. Very good. As you can see, for her muscle strength, it's equal and strong. Again, another normal finding. All right. Next thing we'll have her do is we'll have her actually step down again. This part can also be tested when you have the patient standing up for the ROM test, but we'll go ahead and we'll have her hop from one leg to another. Go ahead. Hop, 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 hop. Very good. So as you can see, she's able to hop back and forth from each foot. And at this point, we'd also have her do the alternate finger to nose test. So I'm going to go ahead and have you close your eyes for me, and you're going to touch one finger to your nose, and then you're going to touch the other index finger to your nose. And actually what we would actually have her do is lift that out a little bit more. And then each time you would, there you go. So as you can see, that's normal too. And then what we'd have her do is sit back down for me. And we would do rapid alternating hands movement. So she's just gonna turn her hands up and down, and go faster and faster. And as you can see, that's normal. So her musculoskeletal assessment is normal as well. Her last assessment aspect would be the skin assessment. And again, you're going to assess that all the way through the exam. Okay? You're going to assess for temperature, color, integrity. You want to make sure there are no lesions, there's no area of redness on her skin. You want to just basically make sure her skin's intact. You also want to assess for skin turgor. Now this can be done by gently pinching on her sternum area or her clavicle area. So what I'm going to do is just go ahead and pinch here really quick. And as you can see, there's no tenting of that area. And that would conclude the exam. At this point, I would have the patient redress, cover her up, make her comfortable, make sure she's safe. So I'll go ahead and help her down. Assess a pain level. And on a scale of 0 to 10, how would you assess your pain level now?
0.
Okay. And before the exam, your pain level would be? 0. Okay. So as you can see, I really didn't cause her any pain during the exam, which is a good thing. So she can go ahead and get your shoes back on. I would also make sure she's comfortable, make sure she's safe. If she were in the hospital setting, handrails would be up, call light would be at reach, and I'd also do an environmental check, collect all my paraphernalia and make sure that it's washed and cleansed appropriately per my facility's protocol. And this concludes the physical exam portion of the tutorial. Next, we will be assessing the teaching plan. Thank you. And I wanted to say thank you again to my patient, Miss DH. She's been wonderful, and now we'll go into the teaching plan.